And it's time now for our weekly update from Santa Barbara County Public Health on the pandemic. Dr. Henning Ansord back with us again. Good to see you, Dr. Ansord.
Thanks, good to be here.
All right, boosters. Do you need one? Do you not? The CDC has cleared it for specific groups. What do we know right now, and who can go get one?
Yeah, exactly. So this is really fresh as of Friday. Who should get one? Everybody over 65. Any nursing home resident or long-term care facility resident, anybody over age 50 with certain underlying health conditions like diabetes, chronic lung disease, heart disease, cancer, pregnant women. You know, there are certain health conditions that somebody, if they were to get COVID, to have really severe disease, and those people should get the booster shot. Now, it's only approved for the Pfizer. So whoever had the initial Pfizer 2 shots should get, in these categories, should get the booster shot. Not sooner than 6 months after their second shot. So those are the requirements, and it's being done already at the pharmacies.
You can go just to their local pharmacy or their doctor. Do they have the boosters as well?
Absolutely. So that would be the way to do it right now. The public health department concentrates on people that have poor access to vaccines. So the boosters currently are given by the pharmacies and by your physicians. Now, the benefit is you can get the flu shot and this shot at the same time. So if you go to the pharmacy or your doctor, just request the flu shot at the same time. Roll up both your sleeves, get one shot in this arm, one in that one, and you're covered for the winter.
That was my next question. You beat me to it. Flu shot's still important this year, right? Even though last year was pretty mild flu season.
Yes. I mean, we are hoping that our mask wearing and continued social distancing will also reduce the influenza incidents, but you never know. You know, it could be a very bad influenza year. We don't know yet. So therefore, we do recommend both vaccines.
Problem getting them at the same time?
No problem whatsoever.
Schools are requiring vaccines. That's nothing new. A kid needs to get the MMR vaccine against measles to be able to go to school. But we're seeing a lot of pushback from parents that maybe don't want to get their kids vaccinated. You know, a certain age group still isn't eligible yet. But what are we seeing with schools right now when it comes to COVID, and especially those kids that are under 12 that don't have a choice to get a vaccine at the moment? When will those vaccines be available for kids?
Definitely this year. We don't know exactly whether in November or December, but the FDA has received the application by Pfizer. They have submitted their safety data, and it's been in the review process, but that takes a little. You know, we don't know exactly how long. And then the Pfizer vaccine should be authorized for use of children aged 5 and older.
When you see some of these protests with parents that are at these school board meetings, what do you think as a physician for these people that say there's just not enough information out there yet?
Yeah, unfortunately, I mean, the opponents, you know, against vaccines are very, very vocal. The majority of everybody is really grateful to get a vaccine. But just because they're so vocal, they sort of they just make more noise, and they are more in your face, right? Now it's, you know, it's everybody's prerogative how they feel about vaccines, but there's unfortunately a ton of misinformation out there, especially on social media. It just gets repeated, and the more frequently you repeat it, the more convincing it sounds. But it's really important for people to get to the right source for information.
California was the first state in the nation to announce that all healthcare workers are going to need to be fully vaccinated. The deadline for that's actually tomorrow, this Thursday. Will hospitals fire those that are not vaccinated in Santa Barbara County? Do you know?
I'm not 100% sure. Yeah, honestly, I'm not 100% sure if they get fired or if they get put on leave of absence, or I don't know. That may be different from hospital to hospital, how they implement that.
You know, when you talk to hospital workers, they're stretched thin anyway. If there are people that are fired at hospitals, if a hospital makes that decision, will they be shorthanded?
That is a possibility. We've seen it in other states, but it's a minority of healthcare workers, the big minority. Like locally in Santa Barbara County, 90% of healthcare workers are vaccinated. So that's a very good percentage. So yes, of course, if we were to lose 10%, that would be really a stretch. But hopefully some of the 10% will get convinced and, get vaccinated so that it won't have such an impact on the healthcare.
Got it. Dr. Henning Ansorg from Santa Barbara County Public Health, thanks so much for joining us and answering some of the questions that we get from people that we see every day. So we appreciate it.
Of course, my pleasure.